Welcome to Module 1 of our educational program. This is by myself, Brittany Hartman, and Samantha Dittmer. We wanted you to be able to put a face to the voices that you'll be hearing throughout the course of this program. Myself, Brittany, is on the bottom, and I will be discussing feeding strategies throughout this program. And Samantha Dittmer is on the top, and she will be teaching about maternal and caregiver mental health. So you can read a little bit about us and how we got here and what our interests are. On this slide, we included topics that we will be covering throughout the course of the next 6 weeks. These topics are subject to change as we are still learning and as we research topics. Sometimes we may want to change up a little bit of what our original plan was.
So why is an educational program important? There's a lack of evidence-based educational programs focusing on maternal mental health related to understanding and confidence in parenting skills for those with children enrolled in an early intervention program. And there is lack of knowledge on what the educational program could entail to produce the best result. Therefore, there's little evidence to support the efficacy of educational programs in the EI population. There's a lot of information given during sessions regarding child development, of course, from your therapist, but we would like to provide detailed information to parents regarding their own health and provide new knowledge surrounding mental health as well as feeding to support a positive environment and better connections with your children. We want to give parents the opportunity to reflect on the quality of their mental health and the quality of their child's feeding, while also providing an opportunity for them to ask questions and reflect. We want to create a community of peer support among families that are going through similar situations, so those who are comfortable are welcome to share experiences. We can learn how to support ourselves through tough times or situations, and also be aware of how these signs and symptoms may present in others. We hope that you can take the education that you learn in this program and apply it in all areas of your life, and maybe even help others who are struggling. We also, of course, want to decrease the stigma surrounding mental health and encourage others who are going through postpartum depression or other maternal mental health symptoms to discuss what they're feeling, either with someone they trust or a therapist. So let's begin with maternal mental health and why do we need it. 1 in 5 women will experience maternal mental health symptoms at some point in their life. That's 20%. This can include postpartum depression, postpartum psychosis, and postpartum anxiety. The interactions that a child has in their early years can have effects on their development, both short and long term, in the areas of language, cognitive development, and emotional regulation. Parental stress, taking care of others, and the effects of maternal mental health can overall negatively impact the individual's quality of life. Depressive symptoms and parenting stress can have an effect on feeding styles and child's health, and was found to be associated with uninvolved feeding. Studies show a lack of knowledge and understanding of postpartum mental health in mothers who need psychoeducation about caring for their infant and themselves. Early intervention programs rely on parents to be consistent and have supportive developmental interactions with their child, and depressive symptoms can really interfere with the parent's ability to do so. Stigma and lack of resources may be impacting the ability for those to receive help that they want and need. And maternal mental health can affect the entire family.
is feeding education important? Half of infants and young children experience feeding problems. This could be a difficulty or delay in learning the mechanics of eating. So this could be related to chewing and swallowing foods. They may have poor eating, which could look like too little or not getting enough nutrients during mealtime. They may have a delay in self-feeding, so relying on mom and dad to feed them. They may have unpleasant mealtime behaviors. This could be crying, screaming, whining while eating, or just not eating. They may also have limited food preferences, so only wanting a certain brand of food or a certain type of food, like only eating chicken nuggets every meal. Parent caregiver guidance is necessary to develop successful eating for the child. It is important to help guide parents on how to respond and react to feeding difficulties. Parenting stress is also common among parents of young children with developmental delays and feeding difficulties, which can put stress on the child during feeding when we're trying to do the opposite. So caregiver education was found to be successful in reducing mealtime behaviors in children and parental stress. Research is unclear, however, if feeding education increases parent-caregiver self-efficacy and confidence and decreases their stress. So that is why I wanted to do this project and create this program.
So like we've mentioned before, both of us are occupational therapy students. Occupational therapy is very diverse, so you may be wondering how exactly we're involved in mental health. So OTs can actually address pelvic health, breastfeeding, and maternal wellness throughout pregnancy, such as addressing pain, anxiety, stress, and depression. OTs work with mothers to help them adjust to their new life role. This may include addressing basic self-care, pain management, modifying the environment to make daily tasks easier and more manageable. They can focus on rest, sleep, family engagement, and creating schedules and routines that make adjustment to life with a newborn way easier. OTs address mental health of mothers by looking at the attachment and relationship style between the mother and the baby. So they really want to help facilitate bonding between mother and child and how to address healthy attachments. So continuing on with how OTs are involved in mental health as well as women's health and EI, OTs promote infant health by taking a holistic approach and looking at everything within the environment. So OTs will address the relationships within the environment, and these may include the relationships between the parent and the child, the parent and their spouse, as well as family and friends. They can also support positive interactions with the child to promote a more supportive and positive environment and to encourage development. OTs will address the mental health of caregivers and family members. We will learn throughout the course of this program how important it is to have a healthy, positive environment for your child. And we can address that by taking a step back and looking at the relationships and routines that happen within the home.
So what is OT's role regarding feeding and early intervention? One of OT's roles in early intervention is to promote engagement in daily life activities, one of these activities being feeding. This may include feeding, eating and swallowing, meal preparation and cleanup, nutrition management, and education such as family training. So why have OT work on these skills with you and your child? Because OTs have advanced knowledge in childhood development and education to teach and share with families to make their daily activities easier. Some of the terms I used on the last slide, you may think of their general definitions, but I wanted to give a more specific definition of each of them. I will be using these terms a lot throughout the course of the program. So feeding, what is it? This could be the setting up, arranging, and bringing food or fluid from the container to the mouth, which includes self-feeding and feeding others. So this could be you setting up the food on your child's spoon and then them bringing it to their mouth. It could be you setting up the food and bringing it to their mouth, or them getting the food on their own out of a container and bringing it to their mouth. Same with fluid from a container. So they may be drinking from their sippy cup on their own, or you may have to bring an open cup to their mouth and help them as the fluid goes in. Eating and swallowing is the keeping and manipulating of food or fluid in the mouth and swallowing it. So moving it from the mouth to the stomach. So with eating, keeping and manipulating food in the mouth, so are they chewing completely to then swallow it, or are they unable to keep the food in their mouth and they have a lot of spillage out of their mouth? And then are they having trouble with swallowing? Are they coughing or gagging when they eat? So this is what we will be looking into. Meal preparation and cleanup is the planning and preparing and serving meals and cleaning up food and tools. So utensils, pots, plates after meals. This is an important process to include your child in when they are old enough to do so. And it is also important for you to be able to plan and prepare those meals that they're going to eat, wanting to eat. So this is an important term as well. And then nutrition management, this is implementing and adhering to nutrition and hydration recommendations from the medical team, which could be us as OTs, and preparing meals to support health goals and participating in health promoting diet routines. So this could be anything from a gluten-free diet or adding probiotics into your child's diet. So OTs can help with that as well, and we'll be talking about nutrition management as well. So mealtime is also an important discussion to have with OT, and we will be talking about what to expect during mealtime throughout the presentation. So occupational therapists promote independence and self-feeding during mealtime. We really want to get the child to be able to feed themselves, whether that's finger feed or with a utensil, and we want to help them be able to do that. OT also improves the ability to eat a variety of foods and textures. So if your child is only wanting to eat chicken nuggets, we help maybe make homemade chicken nuggets rather than buy Tyson chicken nuggets. Then maybe we'll go from less breading on the chicken nuggets to then just grilled chicken. So we help get that variety of foods in a slow and steady way. And we problem solve throughout that process as well. And then occupational therapists also help create a family-friendly schedule for mealtime to make meals easier and help the parent and child both get the most out of mealtime.